Good evening and thank you for joining us tonight. Some new data from a state agency is shedding light on a tragic subject, teen suicide. In this week's Crisis in the Classroom, Tanner Stewart examines how local schools are working to prevent future tragedies and how parents are the first line of defense.
Earlier this year, I interviewed Becky Pringle. She's the president of the National Teacher Union. We discussed the mental health crisis inside schools nationwide and a drastic need for school counselors.
To hire more counselors and social workers and psychologists. We have to do that.
And because of that shortage across our 3 districts, administrators have told me there's difficulty in finding a solution to breaking barriers between school and society. So this week, we're stepping back outside the classroom to address an alarming rise in teen suicides that the Florida Poison Control Center believes can be solved at home. While the CDC reported a 31% increase in mental health related ER visits in a year's time, the Florida Poison Control Center shows a 51% increase over 2 years in calls related to teen suicide. But the problem isn't only in Florida. Data obtained from a national review of Poison Center call data shows a trend of more than 5 times the amount of teen suicide calls over a decade. I asked the State Department of Health for related numbers in our area. The latest data from the Florida Injury Surveillance System comes from 2020, showing fewer than 10 teen suicide deaths across Escambia, Santa Rosa, and Okaloosa counties. But in the same time period, and in contrast, at least 165 teenagers across Northwest Florida were either sent to the ER or hospitalized for self-harm injuries. Inside Florida schools, the state requires at least 2 mental health services providers on each campus qualified to perform suicide risk assessment to students. And each district is required to have their own policy on suicide risk assessment tools, like the Columbia Suicide Severity Rating Scale, used in at least 2 of our local districts. But at least 1 school in every district in Northwest Florida uses the Hope Squad, a suicide prevention program utilized in more than 1,000 schools nationwide. But despite the numerous programs and policies in place, the numbers continue to climb.
This is our shared responsibility as a society. As educators, we cannot address all of the mental health issues that our students already had, but has grown over these last 2 years. The trauma, the loss, the grief, all of that. Educators alone can't address that.
While each school district in our area has plans in place for both prevention and intervention, in just a few short weeks, students will be out of school for summer, spending a lot more time at home, where the Florida Poison Control Center points to the possible solution. More data at the state level. Only 5 teenagers died via drug poisoning across Florida in 2020, but hospitalizations and emergency room visits for self-injuries, including misusing medicine, totaled more than 3,000 cases. Medication safety isn't an end-all solution to teenage suicide, but it does serve as an effective preventative, according to the CDC. At least 50,000 kids are hospitalized each year for getting into their home medicine cabinet. Florida Poison Control strongly recommends these tips for parents. Put your medicine up and away, never leave it in your child's reach, and be sure to put the medicine away immediately after use each time. And finally, medication education. Teach your children who's allowed to give them medicine, and never tell your child that medicine is candy to convince them to take it. If you have questions or an emergency, call the Florida Poison Control Center at the number on your screen. And if you or someone you know are thinking about suicide, call the National Suicide Prevention Hotline at this number. Don't wait before it's too late. This is Crisis in the Classroom. I'm Tanner Stewart.